Good afternoon, everyone, and welcome to our webinar today as well. And thank you to everyone who will be joining us online. When you take a look at this video a little later, please forward it on to your friends and your nursing colleagues as well, because I think it's quite an important conversation that Basil and I are going to have with you today as well, around what is actually happening within the nursing sector in Australia, what the job prospects are like in the future, and also what are some of the key differences between a nurse who is a qualified specialist nurse versus a staff nurse, and some of the differences in the types of work. And it's quite a different story as well as we go along. So what I'm going to talk to you just for a few minutes about is about the future opportunities and the potential for specialist nurses in Australia. So nursing in Australia is basically a window on the world as well. Australian qualifications are recognised around the world with nursing registration boards in everywhere from New Zealand through to the UK, Canada, the US, South Africa, African countries, Middle East, etc. Okay, so completing an Australian qualification opens up the world for you as far as future work opportunities as well. That's the first point. The second point is that the demand for nurses around the world over the next decade, so over the next 7 to 10 years, and that's only the end of this decade and the beginning of next decade, globally, is somewhere around 5 million new nurses will be needed around the world. That's a massive number. And it's very hard to understand, well, how can that possibly be when we've got all of these nurses going through training colleges around the world? However, that's come about because people are living longer. The expertise and professionalism required of nurses has increased as time has gone on. And also the standard of care has also increased. So the responsibility of a nurse within the nursing or the care team is now much greater than it's ever been previously as well. So nurses, staff nurses, bachelor qualified nurses who want to then be able to be part of that future opportunity need to be thinking about specialist training. And that is taking on specialist training to then be working as a critical care specialist, emergency specialist, etc. Now, if you're a nurse who's already working in the Middle East, you possibly already work in a critical care, an emergency unit, a neonatal unit, an acute care unit. Your employer has probably taught you those skills. You don't necessarily have a qualification at that higher advanced level, but you're working in that area. What is happening around the world is that employers and registration bodies are asking those nurses to then formalize your experience and work history with a qualification. And that's why we're talking to you today as well, because some of the courses Basil will talk to you about are qualifications to then take your work experience and your day-to-day job experience and to then convert or basically take those through to the next level and to formalize that with a qualification. Okay. Now let's talk from Australia for a moment. Demand in Australia, the biggest demand in Australia is in the longer term, is for specialist qualified nurses. And primarily because those reasons I mentioned earlier, Australian society is aging, but the quality and the standard of care that's expected and the need within hospitals is for specialists as much as it is for generalists as well. Okay. For internationally qualified nurses, the greatest future demand on work opportunity is with specializations, because it's pretty safe to say, Basil, I think at the moment, most Australian nursing programs are pretty full of domestic Australian students who are going to be coming into the nursing workforce in the next 2, 3, and 4 years. So they're full. So that at that entry level, there's less opportunity for internationally qualified nurses. At the specialist level, there's more opportunity for internationally qualified nurses. Third point, and most important point, everybody needs money to live. So you need to be paid as a nurse. There's about a 10 to 15% difference in the salary that a staff nurse will earn versus a specialty qualified nurse as well. Now that 15% in Australian terms means the difference between being paid somewhere around $70,000 to $75,000 as a staff nurse to being paid $85,000 to $90,000 as a specialist nurse. Okay. If you then want to know the next level, if you are then a master's qualified specialist nurse, your salary range is somewhere around the $95,000 to $105,000 Australian dollar mark. Okay. So that gives you a bit of an idea about the salary benefits and the what you're earning benefits as you then advance your qualification level. So at a graduate and advanced nursing level, so as a specialist, which Basil will talk to you in a moment, it's going to give you about 10 to 15% more salary. As a master's qualified specialist, so with a specialist qualification plus a master's qualification, that will then add another 15%, 10 to 15% to your salary earnings as well. Okay. Now, all of this information is available on a website, because guess what? There's a website for everything these days. Is available on a website which is called Job Outlook. If you go to Google and you just put in Job Outlook Australia, and that will take you to a government website where it basically identifies all of the future job prospects, talks about demand, talks about salary, talks about all of the various aspects of the different job categories in Australia. Okay, so we'll make sure that after this webinar, I'll add that into the chat as well, so that everyone's got that whilst Basil's speaking. And Job Outlook is a great source of information for you to verify and just check what I'm saying to you is actually correct as well. Okay, so that's what I'll talk to you about at the moment. Basil's going to talk to you about basically about the courses, but also about the differences between the work and the scope of work that a staff nurse versus a specialist nurse is actually performing. So Basil, why don't I hand over to you?
Thank you, Simon. Rightly pitch talk. So I will add some important aspect about why the specialization is required in the field of nursing. So let's go back and see some of the history and some of the trends. So if you see maybe around another couple of decades ago, you would have pursued having a diploma in your nursing is all about nursing. So doing a bachelor's degree or master's degree was not that much of importance at that point of time. But in 2022 or 2020s, if you look at, you are getting a notion that even having a bachelor's degree is not really taking you further up in your career. So definitely you are in a state to improve your career as well as your professional development. So that is very important. So over the period of time, the minimum educational requirement that you need in order to get into a good job and to attract a good salary and a good position is going to go up and up. So I would say that is one of the primary motive why you should be doing a specialization in nursing, whether it is renal nursing, whether that is critical care nursing, or whether that is a pediatric or neonatal. So your specialization is something that is going to equip you or tailor you to treat complex patients and complex patient conditions. So if you think about a clinical situation as such, so how bad it is, even though you have 10 years of experience, and you are not allowed to look after a patient who is on ECMO, you might have come across these kind of incidents and this kind of ECMO machines for ages and ages, only because you are not ICU certified. I use the term ICU certified, okay, rather than ICU trained. Only because you are not ICU certified, you are not allowed to look after a patient with the ECMO or IABP. And at the same time, those who have had minimum experience than you is able to look after a patient on those kind of complex machineries. So you yourself, your personality, you are in a state you are questioning your personality as well as your education itself. So it is very important for you to know that only the education is something that you can give you more satisfaction in your life, whether it is personal or professional. So I would say, I mean, that was the only one motive behind me taking up a specialization in nursing. And probably 50% of audience, those who are listening to this video, will also have the similar kind of thought process that is going on. Okay, so that is one of the reasons. And also Simon told us about the monetary benefit that you are getting it. Okay, so definitely we all live to earn for our bread. So definitely giving you more allowance after taking a graduate certificate program or a graduate diploma program or completing a master's program is definitely worth it. Eventually, what you are doing in your clinical settings with all these qualifications are the same. So why don't you get an extra penny, an extra amount for doing the same work only because you are educated in that profession? So all the Western countries, all the European countries, and I think almost all the countries do value your education. The time spent, the time that you have spent on education, the time that you have shown commitment to improve yourself is being recognized by giving you some sort of allowance. So I strongly recommend that should also be one of the reasons why you have to consider specialization in nursing. And also how you are going to take care of a patient when you have an advanced education in any of the field is different from how you are going to take care of a patient with a generic experience. So you understand the rationale behind each and every action that you are taking. So you are able to anticipate the risk. You are able to anticipate if there is any complication that can happen to this patient. And again, you are going to the patient, going to the doctor or the other treating disciplinaries with saying these are some of the options in front of us. This is what I anticipating for this patient. So why don't we intervene like this? So your education is really going to tailor you to such a level that you think critically at the same time comprehensively. Okay, so even if you look at the other professionals, like if but take case of the doctors, we know that we do have pediatricians, we do have neurologists, we do have endocrinologists. So we do have different specialized doctors. So why don't we have different specialized nurses? So in the medical fraternity, it is being accepted specialized knowledge is important. It is not possible for a single nurse or a nurse with a general qualification to look after each and every aspect. It may be too much for you to take each and every system and understand every setting, like to have a mastery over the field in ICU, at the same time how to master the things in an emergency department and how to do geriatric patients. So it is how you approach these patients are entirely different. And we all are human, so our brain or our capabilities might be slightly limited to extend into each and every aspect of nursing. So if we are focused and if we have a focused area to practice and a focused area to educate ourselves, definitely our depth of knowledge will be quite good. Rather than having a peripheral knowledge in each and every setting, it is always worthwhile and it is always appealing as well as satisfying to have in-depth knowledge in a particular area. There comes your specialization. Okay, so if you are a ICU specialized nurse, you know A to Z of ICU. You might not have to exhibit any skills or knowledge. I mean, you still have to have basic knowledge, but you don't have to have a specialized knowledge in dialysis or renal nursing at the same time. Okay, so that is a difference. This is how the specialized courses is gonna equip you. Okay, so that will filter the amount of workload that you are getting, because they know exactly what is expected out of you because you are educated in that area. So if you are a renal nurse, they will post you or they will give you opportunities in the renal ward or a dialysis unit. Similarly, if you're an ICU qualified nurse or a neonatal qualified nurse, they will be providing you opportunities in neonatal area. Okay, so this education itself is opening up a lot of opportunities for you to find an employment, at the same time to be recognized. And I would also like to talk about what is the difference in the career pathway for a general nurse as well as a specialized nurse. So definitely, you know that, I mean, if you are a general nurse, you will be working as a general nurse for ages and ages. But if you are a specialized nurse, you are given with a lot of opportunities in your career pathway, like upgrading yourself as clinical nurse consultant. Even you can do further education and you can become a nurse prescriber, and you can become clinical nurse specialist. You can become a clinical nurse educator. So there is a lot of ample opportunity. The first step for you to reach into all these goals are to do your graduate certificate or a specialization in particular area wherever you have interest. So these are some of the elements that you have to really consider when it comes to nursing. So I would also say in not only in Australia, worldwide, all countries, they encourage the nurses to do their specialization because they know if they are educated in that specialty, they can be wisely utilized and they are knowledgeable and they are open to learn things. So that kind of an employee is what the management is actually looking for. And just before I conclude, I will ask Simon, I will pose a question to you, Simon. Just wondering, suppose, I mean, let it not happen, but we all are human, okay? So you may end up having one or the other kind of difficulty and you may have to go to the hospital. So would you prefer a general nurse or a nurse with specific qualities and well-educated in that particular area to come and treat you? What do you think?
Look, I think the question, that's probably a pretty obvious question, Basil. I'd certainly be wanting, if I had a particular condition, I'd be wanting to know that the nurse who was treating me was a specialist, and that the doctor who was treating me was also a specialist in that area, rather than someone who just happened to be available at that time to try and tell me what's wrong with me. So I think it's a pretty obvious answer.
Yes, yeah, that's rightly said. So, I mean, it is well understood that, I mean, we all, I mean, even if I am ending up into a hospital, I will look after, I mean, like, I don't want an emergency nurse to come and look after me while I am in an ICU setting, because I know it is not that, it is not that kind of a care that I am going to get. So the patient satisfaction will improve, and that will also improve the morale with which that you work when you have specialized qualification. So at the end of the day, I mean, all these things are very important for you to consider while you are taking up a specialization. And that is why I do recommend each and everyone to take up one or the other specialty. It might be anything, okay? So, I mean, depending upon your interest or your experience or your exposure, you can opt different specialities. The nursing fraternity is open with a lot of specialities like pediatrics, neonatal, critical care, emergency, renal, and much more. Okay, so, and even in IHM, we do provide something around 13 specializations, which is very rare to find in other places, offering all these 13 specializations. So, and also having a specialization online is something really important as well. Okay, so you might be working in your place, and at the same time, I mean, there might be a lot of hindrance in front of you, stopping you from going for a specialization. But online mode of delivery and online mode of education in this specialized area, incorporating our simulation experiences and our good teaching faculties around the GCAN courses, definitely will equip you and enrich you with a lot of knowledge in that specialized area. So you can work at the same time, you can do your specialization, and at the end of the day, you step out from your ward or your ICU settings with a lot of satisfaction, thinking that you are educated, at the same time you are trained well enough.
Thanks, Basil. Thank you very, very much. And Basil, so you're aware, is a specialist nurse himself. He's also our course coordinator for our graduate certificate in advanced nursing courses, and that's the 13 specializations Basil mentioned earlier. So, with the advanced nursing specializations, you can take those you can take those over 6 months, or you can take those over 12 months, based on your workload and just how much study. Quite often, if you are taking a specialty program, you're going to be returning to study, and you may not have studied since you finished your bachelor, for example. So it can be a little daunting at times to think, well, how am I going to fit study in with my family, with my nursing duties? So you are more than welcome to take the program over 12 months instead of 6 months, based on your individual situations as well. So we're going to start to close this this particular webinar. I'm going to just tell you about two more things. First of all, as I said, our mission at IHM, or the Institute of Health and Management, is to help you access education in order to advance your employment. So education for employment, rather than just education for the sake of education. So please watch our, keep an eye on this this Facebook channel. Every 2 weeks, we run an online jobs fair, which is where we connect. We bring employers who are have jobs and are looking to identify good candidates. We bring them to our jobs fair, our online jobs fair, and they will talk to you about the jobs they have available, working in different countries, the requirements, and then you can ask them questions as well. The objective of the jobs fair is to help you along with your study, be able to connect into your next position, be that in Australia, could be in London, could be in Singapore, or it could be a new job in the country you're currently working in. Okay, so please keep an eye on our Facebook channel here for the next jobs fair, which will be not today, but will be next Friday. Okay, and I'll just close with one quick close, and that is the Institute of Health and Management is an Australian higher education provider. So we are based in Melbourne in Australia. We have campuses in Melbourne, Sydney, and Perth. And then we also offer our programs online as well. So for nurses around the world, you're able to access the courses either on campus in Australia or online if you want to continue working in the country where you're working in. All of our courses are focused in healthcare, and hence our name, the Institute of Health and Management. We're proud to be working with nurses. We're proud to be helping advance the professional skills of nurses. And that's one area that we will always remain focused in as well. So I'm going to sort of close today's webinar with a special thank you to all of the nurses around the world for the fabulous work that you're doing under really difficult conditions. Every day, Basil and I talk to nurses who are working 12-hour shifts, are working in incredibly difficult circumstances because COVID is still with us. We now have a flu in Australia, and Basil's suffering today is with the flu. We have a little bit of a flu epidemic running in Australia as well, which, to give you an idea, last week in Melbourne alone meant that 1,500 nurses were not available to work last week. Okay, so, and that's a lot, that's a big chunk of nurses in our workforce as well. And that's happening around the world. So to all the nurses working around the world today or watching this after your shift, thank you very much for your efforts, and thank you very much for your dedication to your patients and to the health service. So my name's Simon Schweigert. I'd like to thank you for today's attending today. We will be conducting these webinars once every couple of weeks, and we look forward to seeing you again. Basil, do you want to sign off?
Yeah. Thank you, Simon, once again, and thank you for the time that you have spent in watching this video and live session. If you have any queries or any questions related to our programs and as well as our specialization programs, feel free to give us an email or please give us some comments on your chat box. Definitely, we are happy to answer to all your queries so that we are able to help you in all the possible way. And once again, thank you, IHM. And thank you, everyone, those who have watched and those who wish to watch. And hopefully we will be associated with you in the future. Thank you very much.
Thank you all.